October is Breast Cancer Awareness Month, and we want to make sure you're informed on the risks and know how to stay on top of early prevention methods.
Joining us now is owner and doctor of Innovative Women's Care owner, Marguerite Brathwaite. Good morning.
Hi, you guys. How are you doing?
We're good, we're good. Obviously, you know, an important subject and something that should always be at the top of women's minds. Who is most at risk when it comes to breast cancer?
Everybody's at risk. Everybody's at risk for breast cancer. Most people who have breast cancer don't have a family history of breast cancer. So everybody should be screened, at least when you get to 40 years old. But everybody's at risk for breast cancer. But there are some people that are at higher risk, and those people need to be screened earlier sometimes and more often. So people with a family history of breast and ovarian cancer, people who've had a history of radiation to their chest at a young age, people who have the BRCA gene mutations, people who have dense breasts, people who smoke, drink alcohol, overweight. Those people need to be screened, you know, more often, consistently.
All right.
Yeah, you know, you're mentioning screening. What sort of screening procedures need to be done, and how often do people need to do this?
Exactly, because all mammograms are not created equally. You have 2D mammograms and 3D mammograms, and sometimes we use breast ultrasounds and MRIs. But the mainstay for screening is an annual screening mammogram. And you should always try to get a 3D mammogram. You really want to push your provider to give you a 3D mammogram because they can see through dense breasts and help detect lesions better than a regular 2D mammogram. And everybody should start screening about at 40 years old. American College of OB/GYN says like once a year at 40. But if you're a high-risk patient, you might need earlier screening at 30 years old.
Yeah, for someone who's maybe just turning 40 or hasn't been for a mammogram before, what does the whole process entail?
Well, you should have an OB provider and get your annual exam. Of course, you should always be doing your breast examinations, you know, yourself, but that's really hard. People don't really know what to feel. So, you know, you go see your OB provider and have a breast exam, and they should schedule your mammogram for you. Because the most important thing, mammograms can pick up cancer years before they feel a lump. So sometimes you'll get in a breast exam and they don't feel anything, but that's why you do it in conjunction with your breast exam, because a mammogram can pick up cancer years before you feel a lump, and that saves lives.
Yeah, you mentioned the importance of mammograms and really breast cancer being a concern for everyone, but especially for African-American women. Why is it so important?
Well, African-American women, even though they're less likely to get breast cancer, when they do get breast cancer, it's usually the most aggressive breast cancer, and they can get it at a younger age. And they're 40% more likely to die from breast cancer than their counterparts. So it's really important for African-American women to be screened.
Yeah, what is the role of breast MRIs?
Well, we're starting to use breast MRIs a lot more because using the magnets and contrast dye, it helps delineate the tissue better so you can pick up lesions and breast cancers. But you can kind of get a lot of false positives, but you want to get an MRI when the doctor thinks you're high risk. And so people with dense breasts might get an MRI, or, you know, the early radiation to the chest when they're young, strong family history sometimes may lead their provider to get an MRI. But and also now when we get the reports for mammograms, they're saying that, I see them on my reports now, like your lifetime risk for breast cancer, and they'll give you a percent. So they may say 5%, 10%, 20%, and then they say anybody with 20% or higher lifetime risk for breast cancer, they're recommending breast MRIs.
So it's like a helpful indicator
Yes.
as well, right?
Yeah, well, this has been really important information, and I want to kind of switch gears here. You've actually officially moved into your new location.
Yes.
So where can people watching find you?
So now we're located in Boca Park. We're on 851 South Rampart, Suite 160. So come and get your annual exam and your breast examination and your mammogram referral.
Yeah, are there any final quick words you want to share with the viewers at home before?
Just remember that mammograms save lives. If you pick it up early, the survival rate could be 90% or higher if they get it early in a localized, you know, spot versus when it becomes invasive. So make sure you get your mammograms.
Right.
Dr. Brathwaite, thank you so much for joining us this morning. For more information and to see Dr. Brathwaite for your next appointment, just visit innovativewomenscare.com.